Congress has appropriated roughly $175 billion so far to help hospitals and other healthcare providers weather the consequences of this COVID pandemic. But some hospitals are struggling to keep up, and racial disparities in the American healthcare system are magnifying the problem. William Brangham is back with our latest conversation he recorded earlier from the front lines of this crisis.
We go now to the city of Chicago, a city that's dealing with its own rising outbreak. And one small hospital on the city's south side, Roseland Community Hospital, and how it is struggling to keep up. The front page story in the Chicago Tribune recently said it all: outgunned, outmanned, and underfunded. I'm joined now by Roseland's president and CEO, Tim Egan, and by the manager of its emergency room, Lynette Houston. Thank you both very much for being here. Tim Egan, to you first. For those of us who can't see inside your hospital and see what you all see every single day, can you just give us a picture of what it's like in there now?
Well, our emergency department has been overrun. We have 19 bays in our ED, and right now you can find gurneys at the nurses station, patients being treated right in the middle of the hallways. The demand for our service has been overwhelming, but we've been meeting that demand. And it's why we say it's a bright hope during dark chaos. We're giving people a chance to recover from this disease. We're giving the best treatment possible, and I just can't commend our staff enough. Folks like Lynette, our doctors, our EVS, everyone is stepping to the front lines and delivering the care that people need.
And Tim, staying with you for a second, could you just give us a sense of who your patient population is?
Well, the new Roseland Hospital is on the far south side of the city of Chicago. We're the last hospital within the city limits on the far south side. We're in the greater Roseland community, and 96% of our residents are African American, and over 87% of our patients are Medicaid patients.
And Lynette, the same question to you as I asked Tim. We can't see inside your emergency room or your ICU. Can you give us a snapshot of what it's like, the kinds of patients that you're seeing there?
The kind of patients that we're seeing here is patients who coming in suspecting that they've been infected by the virus. We have a 19-bed ER where we have other rooms where we can improvise and put those patients there, which would come up to like 22 beds. But we're also using beds around the nurses station, where we could put at least 8 beds around the nurses station. These people are coming in and they're sick. They're sick. I know the news says stay home and try to take care of yourself at home, but these are people who use the emergency room as their primary physician, because a lot of people in this area don't have their own primary. So the emergency room is their primary doctor, where they come here for services.
We hear, Tim, a lot of these, that Congress is passing billions of dollars out to the states and to businesses to try to keep them afloat. Are you getting help from the state to help offset some of these costs that you're incurring?
So we've seen some federal aid that came from the Payroll Protection Program, but we're seeking many more grants. We need more support. We've tested 10,000 folks who've come down to our hospital for COVID-19 testing. You know, the Roseland community is 7% of the population of the city of Chicago, and right now we're 16% of the COVID-19 deaths. That showcases the disparity in the funding of healthcare that has happened over decades in the city of Chicago. While I've seen Medicaid dollars flood out to resources in the suburbs, to multi-billion-dollar corporations, hospitals like Roseland have been underfunded. You know, when I said on the front page of Chicago Tribune, we were outgunned, outmanned, and underfunded, I meant it. We don't have the resources. We don't have a reserve of funding that we can use to buy new equipment and hire more staff. And that's because of this woeful lack of funding that we've received over many, many years.
Lynette Houston, Tim is describing a situation that sounds like a terrible circumstance for the staff that has to work in and day out. I mean, obviously, the stress of this kind of work in a contagious environment where people are worried, obviously, about themselves getting infected, and yet it sounds like you're having to work incredibly long hours just to meet this demand. How is everybody holding up?
My staff is really tremendous. I take my hat off to them because it's really, it could be sometimes overwhelming, but sometimes we go into chats where we try to laugh. We try to, not look at the other side of it, which is the dark side, because sometimes we do lose people. The numbers of the deaths is rising, and it has happened here also, and those families cannot be with their loved ones. So it doesn't make our day easy, but we have to keep moving forward. We have to keep fighting. And my nurses are really tremendous. The ICU nurses are really tremendous.
It certainly sounds like it. Lynette, I understand you haven't had a chance to see as much of your family personally as you would like to.
I haven't. I don't, I don't. My daughter doesn't live here, but I normally go see them every weekend. I don't go because I don't want to go around them right now.
Because you're worried about infection?
Yes, but it's not only me, it's my whole staff. I have one employee that lives in the garage now. I have one employee moved out of her house because she didn't want to be around her mom who is sick, who has a condition where it's compromised, so she don't want to be. So it's not only me, it's the sacrifice that we make, and it's a whole group effort. So no, we haven't seen our families.
Tim Egan, you said that you have been complaining about the underfunding of hospitals like yours for years, even before the pandemic. Do you think that this crisis will actually be the thing that finally wakes people up to the importance of community hospitals, to rural hospitals, to small health centers like yours?
I'm praying to God that it is. The number of deaths in the African American community due to COVID-19 is a call for hope, a desperate call for hope, that we finally get the decision makers to realize that communities like Roseland deserve an investment in the healthcare services. These folks are dying because they have comorbidities. Folks are dying because they have quadmorbidities. That's because we don't have the ability to treat folks when they, at their earliest onset of diseases like asthma, COPD, heart disease, obesity. We need funding for programs, for primary care programs, for outreach to these folks to get them on a path of wellness and overall health. And without funding that is absolutely available, we won't be able to do that. And you'll just see more disparity in the deaths in the African American community without that desperately needed funding.
Tim Egan and Lynette Houston of Roseland Hospital on the south side of Chicago, thank you both very, very much for talking with us, and good luck with all of your work out there.
Thank you.
Thank you. I appreciate it.
And one other note, this is National Nurses Week. We want to give a special thanks to Lynette Houston for speaking with us, and a shout out to all the nurses working on the front lines of hospitals, clinics, and healthcare providers around the country. Thank you. More than 100 nurses in the U.S. have died since the pandemic began. That's according to National Nurses United, the largest union of registered nurses in the country.